Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a young patient, age 6, who attended the clinic, really struggling to hear from both ears, and they've had this impaction for quite a while now, and they've had a couple of unsuccessful attempts of having the earwax removed elsewhere. For that reason, the patient was very anxious, understandably, and very nervous, and they had very narrow, twisty, bendy ear canals. You can see here the Zollner suction probe that we're using. The diameter of it is 2.2 millimeters, and there's not much space around it in the ear canal, so that gives you some perspective of how narrow this ear canal was. And we're just starting off in the worst, the left ear, and it was a bit of a struggle at times, just because it was so impacted, this ball of wax. And whenever you're treating a young child, not just young children, of course, even adults, but young children are naturally a bit more anxious and nervous and a bit more unsteady, but they did brilliantly well, and the parents were really great, because they were stood beside the patient during the procedure, and mum was holding the young child's hand, which is, it's always reassuring for the patient. The father was watching the video as well, so although that can be a bit more nerve-wracking for myself when someone's watching over your shoulder, but for the patient, the child, knowing that their father's watching the procedure, it's very reassuring for them. And I'm just trying to wriggle this out. There's no other way of removing this. I'm just tugging left to right. You can see there's not much room for manoeuvre, because the ear canal's so narrow, and I've just put loads of drops in. I'm just really tugging at this. Now, this plug extends from the entrance of the ear to the eardrum, and I'm using the iClearscope endoscope here. And typically when we use an endoscope, we position it against the ear canal, so it kind of rests it and it stabilizes. But in this case, I'm holding, obviously, the endoscope in my non-dominant hand, and there's nothing to support it, so I'm having to hold it. We don't use a tripod, and in this particular case, because of the shape, anatomy of the ear, I'm not even resting it against anything, so that makes it just a bit more difficult, because whilst I'm wriggling with my right hand, I've got to just keep my left hand on the object, which is the wax, and you can see we're just trying to get that in centre view, and we're slowly but surely bringing this forward. It was almost like a Malteser when I took this one out, and it was really hard. It was solid, like a stone, and we actually dropped it on our medical trolley, and it made a ping. Now, again, the patient was brilliant, very stable, and it always helps when the parents are there supporting and next to the child, and they just feel reassured. So you can see I'm slowly bring this forwards. There were patients admitted probably a bit apprehensive whether I would be able to remove it, because obviously they've had a couple of unsuccessful attempts, but I was confident we were able to do it. As long as the child was able to stay still, I was pretty sure we were able to remove this. See, slowly coming out. And we've just recommended the patient, because it's a young child, and they're just very nervous about it happening again. It may not work, but I'll come back to that in a moment, sorry. So there's the patient's eardrum, nice and healthy, it's textbook. I've just advised the patient to use some olive oil spray on a regular basis. And in fact, I put the olive oil spray in both ears before commencing. Now, this is the right ear. It's just a bit blurry because I've got the oil in the ear at the same time, just as I'm vacuuming it. The right ear was a bit easier to move. It wasn't as hard and solid. You can see there's little movements left to right. I'm just wriggling this, teasing this out of the ear. And we're having to go with the bend, because we've got a bendy ear. As you're extracting this wax plug, you're having to bring the sucker around the bend to curve the wax around the bend. Otherwise, there'll be an obstruction there. You can see it's slowly coming out. This came out a lot easier. Just going back in. There's a bit of staining just to the left. I've left that. The eardrum's otherwise nice and healthy. Child does brilliant. We don't want to go in and unnecessarily. That's not going to affect their hearing at all. By me, with this particular patient, and it would be different patient to patient, for me, going back in there, trying to remove that little last piece of staining of wax off the eardrum, it might traumatize the patient who's young, and it will kind of almost cause them to be almost potentially having a phobia next time they're having their ears cleaned. So we don't want that with children. So as an audiologist and clinical ear care specialist, sometimes we just have to quit whilst we're ahead. So we don't want to do something silly and traumatise the patient necessarily. But I hope you enjoyed that video. I hope you're all keeping well and safe. And remember, be nice and be kind. Thank you. Bye.